The way you masturbate can be harming circulation, sensitivity, and even your ability to maintain firm erections. I'm Dr. Emily Collins, a urologist, and I want to show you what really happens when this act is practiced incorrectly and repeatedly. The problem is not masturbation itself, it's a natural, healthy behavior and part of male physiology. The problem lies in excess, speed, and the way the brain is conditioned to seek pleasure. Most men masturbate in a rush, without paying attention to the body, and with intense visual stimulation, usually watching pornography. This combination creates an artificial pleasure pattern. The brain begins to associate arousal only with fast, intense stimuli, and the body loses its natural sensitivity. This explains why many men report less rigid erections and less intense orgasms after years of uncontrolled masturbation. But the impact goes beyond the physical. Excess dopaminergic stimulation makes the brain lose the ability to feel pleasure in other areas of life. A man becomes less motivated, more anxious, and dependent on quick stimuli. Pleasure turns into an escape, and the body pays the price. The path to change starts with understanding. Knowing what the body needs and respecting your own pace is the first step to regaining vitality and control. Pleasure should be a conscious choice, not an automatic reflex. Make sure you're already subscribed to the channel. At the same time, the nervous system increases blood flow to the penis, dilating the arteries and allowing an erection. Up to this point, everything is natural and healthy. The problem begins when this process is repeated with excess, speed, and artificial stimuli. Dopamine, the hormone of motivation and the pursuit of pleasure, is released in large quantities during masturbation, especially when there is intense visual stimulation. These dopamine spikes are followed by abrupt drops, creating a chemical cycle of dependence. The brain starts to seek quick pleasure as a form of relief, and natural sensitivity diminishes. This mechanism is the same involved in other types of compulsion. The more stimulus, the less real pleasure. The penis also suffers from the wrong kind of repetition. Masturbation done very quickly and with excessive pressure can alter the pattern of erectile response. The body learns to depend on a specific type of touch to reach orgasm, which makes performance harder during real sex, where the stimulus is gentler and emotionally involved. This is what many men describe as penile desensitization. Another important point is the impact on blood flow. The penis needs efficient circulation to maintain firm, healthy erections. But when it becomes an automatic and exaggerated habit, the nervous system goes into overload. Pleasure ceases to be a conscious experience and becomes just a chemical reaction that drains energy and focus. Understanding what happens inside the body is the first step to changing the habit. A man who understands his own biological mechanisms gains control over them. And that control is what defines the difference between healthy pleasure and self-sabotage. Uncontrolled masturbation has a direct and cumulative effect on penile sensitivity and erection quality. What begins as an apparently harmless habit can, over time, completely alter the body's natural response to pleasure. The brain and the penis function as a single system, and when this system is stimulated in an artificial and repetitive way, it adapts, just not in a way that supports sexual vitality. The first impact is the loss of sensitivity. Masturbation done with force, a fast rhythm, and intense friction creates a mechanical response the body comes to recognize as normal. The problem is that during real sex, the physical stimulus is lighter and the emotional component is more complex. The brain, conditioned to the fast, visual pattern of masturbation, does not react the same way. The result is difficulty maintaining an erection, less intense orgasms, and less pleasure in real contact. In addition, excessive friction can cause small inflammations in the skin and blood vessels of the penis. Over time, these microinjuries reduce the sensitivity of nerve endings and affect local circulation. The penis needs full blood flow to achieve and sustain an erection, and any vascular damage, even small, compromises this process. From a neurological standpoint, repeated stimulation generates dopaminergic desensitization. The brain starts to need increasingly intense stimuli to produce the same sensation of pleasure. This tolerance pattern leads a man to masturbate more frequently and with stronger stimuli, perpetuating the cycle of loss of sensitivity and dependence. Another common effect is so-called conditioned ejaculation. The body gets used to reaching orgasm in a specific way, usually in a few seconds and with a high level of muscular tension. When this pattern is carried into real sex, the man loses control and ejaculates earlier than desired. The problem is not physiological but behavioral. The good news is that the body can be reconditioned. Over time, it is possible to restore sensitivity and regain firmer, more natural erections. This begins by changing the type of stimulation and reducing the use of pornography, allowing the brain to reconnect with real pleasure rather than quick pleasure. The penis, like the brain, needs re-education. The disconnect between real pleasure and artificial pleasure is one of the biggest problems in modern sexuality. The male brain, evolved to associate pleasure with physical and emotional contact, is being conditioned to seek instant, visual stimuli. Pornography, combined with rushed masturbation, creates a false reality in which pleasure is fast, predictable, and devoid of human involvement. The body adapts to this pattern and begins to reject the naturalness of real sex. When a man gets used to this kind of stimulus, the brain stops associating pleasure with touch, gaze, and presence. Dopamine, released in large quantities during masturbation with pornography, reinforces addiction to images and unreal situations. Pleasure stops depending on experience and starts depending on content. This means that, over time, a man no longer feels natural arousal, he needs artificial stimulus to connect with his own desire. This disconnect directly affects performance and self-esteem. In real sex, the brain does not receive the same dopamine spikes generated by a screen, and the body is slower to respond. The penis seems to disobey because it's conditioned to another type of stimulus. Many men report difficulty maintaining erections or lack of interest in real partners, even when physical desire is present. This phenomenon is called visually induced sexual desensitization. Artificial pleasure also changes the perception of emotional pleasure. Fast, repetitive masturbation creates a cycle of dopamine release and crash, which reduces the ability to feel pleasure in simple things, work, training, relationships, and even personal goals. A man lives chasing the next peak, but with less and less satisfaction. Real pleasure is completely different. It involves presence, connection, and hormonal balance. The body responds more naturally, the penis regains sensitivity, and the mind reconnects with the moment. The difference is noticeable. In real pleasure there is calm, in artificial pleasure, only discharge. Reversing this disconnect is possible. The first step is to reduce visual stimuli and reconnect the brain to the body itself. Dopamine needs time to readjust, and when this happens, pleasure becomes intense and genuine again. The man who restores this connection not only improves his sex life, but also his mental clarity and sense of purpose. The cycle of sexual and mental fatigue is the direct result of abusing immediate pleasure. When a man masturbates excessively, especially using pornography, the brain and body enter a state of chemical exhaustion. Dopamine, which should function as fuel for focus, motivation, and desire, gets drained in excess. The result is a constant feeling of tiredness, discouragement, and lack of will to act. At first, pleasure seems to relieve stress. After ejaculation, prolactin is released, a hormone that causes relaxation and sleepiness. In normal doses, this is healthy. But when the cycle repeats several times a week, or even per day, the body doesn't have time to recover. Excess prolactin, combined with drops in dopamine and testosterone, creates what we call dopaminergic fatigue, a form of burnout in which the brain loses the ability to self-motivate. This fatigued state goes far beyond the sexual realm. A man starts to lose energy for work, training, and personal goals. Things that once brought satisfaction seem dull. The mind becomes dependent on quick stimuli, and any task that requires patience or effort feels unbearable. Pleasure turns into a chemical habit, and the body, which should feel rewarded, begins to feel drained. Over time, this cycle also affects self-esteem. A man realizes he's not in control, feels guilt and frustration, but repeats the behavior because the brain has already linked masturbation to relief from discomfort. It's a mechanism similar to anxiety. The momentary relief comes, but the emptiness afterward is greater. The penis responds less, the mind becomes more scattered, and motivation disappears. Breaking this cycle requires awareness and patience. When a man reduces stimulation and gives his body time to re-establish itself, hormone levels rebalance. Dopamine returns to functioning naturally, and pleasure stops being a quick discharge and becomes a lasting sense of well-being. This recovery changes everything. The mind becomes clear again, the body regains vitality, and sexual desire becomes healthy and controlled. Pleasure stops consuming energy and starts providing it. That is the difference between impulsive pleasure and balanced pleasure. Correcting the habit of uncontrolled masturbation does not mean abandoning pleasure, it means relearning how to relate to it. In the first few days, the body may feel anxious or restless. This is normal. It's the nervous system adapting to a new form of pleasure, more balanced and authentic. The second step is to slow down the pace. Rushed masturbation teaches the body to seek a quick orgasm, which harms control and sensitivity. Practicing mindful touch, with calm breathing and focus on sensations, helps reconnect the brain to the body. This simple change transforms masturbation into something therapeutic rather than compulsive. The third step is to redirect sexual energy. Physical exercise, especially strength training, helps stabilize hormone levels and channel accumulated energy. Creative or mental activities, such as reading, studying, or meditation, also help the brain associate pleasure with productivity and not just sexual release. This is the foundation of dopaminergic reprogramming, teaching the mind to feel pleasure in growth, not just in relief. The fourth step is to respect the body. Masturbation doesn't have to be forbidden, but it should have a healthy rhythm. Regaining vitality is a process. It's not about eliminating desire, but integrating it with discipline. When a man can control pleasure without repressing instinct, he notices that the body responds with more energy, more focus, and more confidence. Pleasure stops being an enemy and becomes an ally of balance. A man who understands his own body never loses control. He learns that pleasure is a powerful tool, it can destroy or strengthen, depending on how it's used. When impulse is guided by awareness, pleasure stops being an escape and becomes energy, focus, and self-confidence. The body, mind, and desire begin to work together, and that completely changes how a man lives. Mastery over one's sexuality is the true mark of male maturity. A man who controls his masturbation rhythm, understands his limits, and respects his cycles lives in hormonal, mental, and emotional balance. He does not depend on artificial stimuli to feel good. Dopamine, testosterone, and blood flow remain stable, and the result is a stronger body and a clearer mind. This control brings something beyond sexual health, it brings presence. A man stops being distracted by impulses and starts acting with purpose. He realizes that pleasure is far more intense when it comes with connection, awareness, and self-mastery. The penis responds firmly again, pleasure becomes deeper, and sex more satisfying, because there is harmony between mind and body. This change also shows up in other areas of life. The same man who learned to control pleasure becomes more focused at work, more patient in relationships, and more emotionally balanced when facing challenges. Physical control turns into mental power. He is not driven by momentary urges, but by real goals. The human body was made to feel pleasure, but also to evolve with it. The secret lies in understanding your own functioning and making it an ally. When a man understands this, he becomes the owner of his energy and his life. If this content helped you understand the mistake 80% of men make and how to prevent it from destroying your vitality, subscribe to the channel, leave your like, and comment below. Have you noticed how the way you masturbate affects your energy and performance? And take the opportunity to watch the next video appearing on the screen. In it, I'll explain how to reprogram your body to regain full control over pleasure and power.